Africa in Motion is bringing a new topic today. We are going to talk about conception and fetal growth. When you check the testes and the whole male reproductive system, you can realize that inside the testes, there are cells inside. You will hear what we call Leydig cells, Sertoli cells. They are responsible for fabrication of spermatozoa. Once they are fabricated and they are ready to be ejaculated, they will come into this canal called vas deferens, which is this one. They come all along, they take this direction until they reach this area where they will be diluted with the fluid coming from seminal vesicles. The seminal vesicles, they are these ones, and the prostate gland as well. We put another fluid so that they can be enough to be transported in erect penis until they will be deposited in a female genitalia. Once they are deposited on the cervix, they will enter through the cervix, going in the uterus. Some will come this direction, others will go to this direction in the fallopian tube until they meet halfway with the ovum, which was laid by this ovary. And the ovum will be caught by what? By fimbria, which like fingers, which will catch the ovum. They meet halfway, then they come in the endometrium inside the uterus, where the product will be implanted. The implantation will be done after the spermatozoa have met the ovum. The spermatozoa come in a very high speed rushing, competing to reach the ovum. They come and they will be one will enter. Actually, it's like a first come, first served principle. Once the first one arrives, immediately there will be a membrane that is formed to protect any other one to come inside. So only one will fertilize the egg, then the others will remain behind. Unless they come two at the same time, they touch the ovum at the same time, then to produce twins. Though there are other modes of production of twins that we can discuss on a later stage. So once the spermatozoon has arrived, it will attach, then it binds to the ovum, then it will penetrate deeper until it is inside. So the cell now from the male will join the cell from a female to make one cell. From there now the multiplication will start. So this is the fertilization, the conception take place, then the zygote will move this direction coming to the uterus. Two cells will give 4, 4 give 8, 8 16, 16 32, 32 64. It continues like that until it becomes a bigger structure, starting now sending the roots in the endometrium, the inner lining membrane in the uterus. Now, how it goes, once now this product is implanted in the uterus, it will start forming what we call placenta, the part that will be fetching nutrients, blood, oxygen, from what? From the endometrium. You can see the mass of the uterus has many vessels. The vessels will start increasing in number. As the uterus grows bigger and bigger, the vessels will increase in number. You can see the placenta now is growing as well, attached to the endometrium. This red, the reddish part, which is endometrium, and fetch blood taking it to the baby. As the baby grows, a lot of changes will be taking place. Of course, there will be fluid around the baby, protecting the baby. And there will be this amnios, we call it amniotic sac, which covers the baby. The baby will continue to swim inside. You can see the cord. Now, you can see as the baby is growing, the baby can take any position in the uterus. Like now here, the baby in the breech. The cervix is well closed. There is a glue protecting the baby, that nothing should come from outside coming inside. So the placenta continues the job to feed the baby. You can see the baby now is changing the position. In this condition, the baby is in a transverse lie, where the head is on right side, the buttocks is on the left side. Now you can see lower part is very well closed. The uterus is growing bigger and bigger. The vessels are many. The placenta is on top. Good insertion. We don't want insertion which is beyond this muscle, because it will cause problems. So as the baby grows up, preparing to come out, you should now start presenting the head. We want the vertex to be the presenting part, particularly in anterior position. The cervix will start now becoming thinner and shorter. Near delivery, it will be more thinner and thinner until the baby comes out. So that's how it goes in short, but we need now to talk in more details as we approach more topics. Always, you are free to ask questions. You are always to ask questions, which topic should we discuss about? It is our time. Health education and health promotion.